Hello again. This is Mark, and I thought that I would chronicle the timeline of my diagnosis with ALS. My earliest recollection of realizing there was probably something wrong happened in January of 2014. I was camping, and I noticed that after getting up in the morning to start doing my normal routine, I was having a lot of trouble with my left hand. It wasn't responding like my right hand was. Initially, I didn't think much about it, but I did bring it up to my primary care provider when I went to him for my yearly physical a couple of months later. After doing a brief exam of me, he decided that he wanted me to go see a neurologist. His logic was, since I was only having problems with one hand and not both, that the issue was not going to be related in any sort of deficiency of either vitamins or minerals like vitamin C or zinc or vitamin D. But since it was just one hand, it very well could be neurological. So he recommended I go see a neurologist. Around April, I was able to see the neurologist, and over the next several months, I went to see him to get various tests done. The very first thing he ran on my very first visit after interviewing me was an EMG, which is a test where they stick needles into your muscles and run an electric current through it to view the reaction. It was an uncomfortable test that he performed on my right and left side. After this test and a few other manual tests, manual dexterity tests, he determined that I was probably suffering from carpal tunnel syndrome in my left hand. I was relieved by this. He said, wear a brace and come back and see me in 3 months. So I got a brace and wore it for 3 months, but I did not feel any improvement. Matter of fact, things appeared to get worse. So at that point, I went back. He ran more physical tests, ordered a lot of blood work, and I went back to see him about a month later. The results of my blood work were all negative. There were no indications of any autoimmune disorders or any infections, nothing viral, nothing bacterial, nothing that they could point to. Really, no clues whatsoever on what the problem was. At that point, he ordered an MRI of my neck to see if there was a pinched nerve causing the problem. So I went and had the MRI done, and it came back with no indication of any issues with a pinched nerve. There was a little bit of bulging in the discs, but nothing that was beyond normal wear and tear for somebody my age. Nothing that would impact or pinch a nerve. After the result of that test, my neurologist at the time was a little confused, so he ordered a biopsy on my left arm. Right there's the scar. It was about 2 inches long, and the sample they took was approximately 2 inches by 1 inch. And this was surgery, day surgery. So I we went to a surgery center, and I had that biopsy taken. And the pathology was performed at the University of Texas Southwestern Medical Center. It came back showing that there was denervation, but they didn't know the cause. Now, if you've ever read a pathology report before, you realize it's all medical speak and it's very difficult to understand. So I would Google key phrases of that and try to piece things together, and was getting a clear picture that there was something seriously wrong, but I didn't know what it was. During this time, I have a friend of mine who's also a doctor, but he lives in another state, and I emailed him all the test results, and he had told me things that I needed to discuss with my neurologist. My neurologist discussed the results of the test with me, and I want to say he ordered a little bit more blood work, which all came back inconclusive and wouldn't point to anything. But at this point, which I think it was probably November of 2014, he told me that I don't want to scare you, but I get the impression from everything that I've seen, he said, that I believe you have ALS. And I want you to go get a second opinion from the ALS specialist in the Dallas area. So he set up an appointment, and they weren't able to see me till the beginning of February of 2015. So beginning of February 2015, I went to UT Dallas Southwestern Medical Center and went through a very long physical exam, as well as another round of blood work. I had taken my MRI film with me so he could see it. He had copies of all my test results. And he said that he had other tests he wanted to run, including blood work. So he ordered blood work, which I had done. They come back inconclusive. Around the middle of the month, he scheduled another EMG. If I said EKG earlier, I meant EMG. But it's an EMG. And he and one of the residents administered this EMG towards the end of February 2015. It was 10 times more uncomfortable than the first EMG. And when I asked about it, he said that sounds like the first time they didn't administer it properly. So if you haven't had an EMG before and you think you have ALS and they schedule one, be prepared for a very, very uncomfortable experience as they stick the needles in your muscles and they wiggle them around and run current through them. It's not pleasant, but it's a necessary evil to get a clear diagnosis. With the results of that, they could clearly see there was a problem, and he said, according to everything they had, it was highly likely I had ALS. And he was giving me a preliminary diagnosis of that. And in February 2015, I started taking Riluzole, which was at that time the only medication approved by the FDA for treatment. It doesn't cure it. It only slows down the progression in a very, very little way. And it is hard on the body sometimes, especially the liver. If you are susceptible to liver issues, you may not be able to take it. But I took that for close to 3 years. A year after my official diagnosis, I wasn't progressing physically very badly. It was a pretty slow progression. So my neurologist wanted me to take immunotherapy, which was usually prescribed for people with multifocal motor neuropathy, which is an autoimmune disorder which they thought I possibly could have. And I was on it for about 4 months or so, and there was no improvement in my condition. So at that point, they were pretty sure that it was ALS. And that brings me up to today, where like I said, I'd taken the Riluzole for about 3 years, but I stopped taking it because it was expensive and it really wasn't doing any good. I started progressing a lot more rapidly about 6 months before I stopped taking it. And I just didn't see the need in spending $150 a month on something that wasn't really doing me any good. Now there is another treatment that is FDA approved, but considering my lung capacity is so far diminished, I doubt that it would do me any good. So considering the incredible expense of it, it costs about $150,000 a year for the drugs, and there's no guarantee my insurance would even come close to covering it. I've decided to opt out of it. The odds of it helping are very, very slim. And even if they did help, all it would do is prolong the inevitable. And so I wasn't looking forward to, spending any more time in agony than I had to. So, especially if it's going to cost $150,000 a year, which is something I obviously can't afford. Well, I think that's probably everything I want to talk about today. I'm hoping to do one or two more of these. But again, for anyone that sees these, have questions, leave notes, and I'll be more than glad to try to get back to you or comment as needed. And take care, and God bless.